Hello and welcome to Health Assay. I'm your host, Amazing Tipe. Now, in a dynamic landscape of healthcare, achieving excellence goes beyond individual efforts. It requires synergic collaboration of various stakeholders. Now, nowhere in this collaborative spirit is more vital than in Nigeria, a nation with a healthcare demands that is as diverse as our population. Now, the pursuit of business-driven healthcare excellence is not merely an aspiration. It is, however, a pressing necessity in a country with a vast healthcare landscape. Today, we're going to be talking about business-driven healthcare excellence through multi-stakeholder collaboration in Nigeria. And joining me as we have this conversation is Adesegun Damazio, and we are also going to be having Debo Odulano, who is the Chief Innovation Officer of Evercare Hospital. Everyone, you're welcome to Health Assay. My name is Amazing Tife. I'm your host for today, and today I have with me Adesegun Damazio. I have Dr. Debo with me. Dr. Debo is the Chief Innovation Officer of Evercare Hospitals, and today we're going to be talking about multi-stakeholder collaboration in healthcare delivery. I have some questions, and I'm sure we're going to be having an exciting time. So I'm going to be starting with Adesegun. So could you just share some intriguing approaches or success stories where innovative business models have positively impacted healthcare outcome in Nigeria?
All right, thank you. It's a pleasure to be here again for a second time. So, it's also nice to be here with Debo Odulano. He's a very good friend of mine. So, basically, speaking about innovative models or practices that have benefited the healthcare sector, I think the examples are numerous. And I think most critically, I'll use maybe a recent event or a recent conversation I had with one of the co-founders or one of the guys in the founders community to more or less make a case for my point, and that's with regards to medical documentation or medical records from people that we because maybe about 10 years ago, the whole concept of digitizing documentation was more or less futuristic. As at then, of course, we knew it was possible, we just didn't know when Nigeria would adopt it. So then came a group of solution finders in the healthcare industry trying different approaches to see how best they can make things better in the Nigerian setting. And of course, he also happens to be a very good friend of mine. His name is Henry, my mascot. So he runs a platform called Duracell. And Duracell, in one sentence, is basically simplifying medical documentation or medical records via digital channels. So what that has done is that you go to hospitals now and you see a marked reduction in the use of paper and biro for a lot of inter-operational or interdepartmental engagements. Previously, patients or even staff would have to carry files from one unit to another for documentation. And what you will see is some details might get lost in transit. It might be on paper that has fallen off, it might be illegible handwriting and all of that funny stuff. But with medical records and documentation, of course, there is no such thing as illegibility with typing. What you type for you type is very visible. And what that also does is it has reduced to a significant extent the physical movement that usually takes place when these records have to be transferred. But now, with just a click of a button, you can literally see the medical records of any patients, the drug records, all kinds of things, and from your own respective units. Even if it has to do with units that are situated in various locations, it's different if you're in just one building. You can say, okay, let me go from floor 1 to floor 2. But what then happens if the next unit is about 10 blocks away? So what this medical record has done is it has simplified these processes, and clearly it took methodic thinking for us to get to that point. It wasn't just the blanket approach. It was specifically tailored to the context of Nigerian hospitals, the scale of their operations, and where they would like to be. So when you check the platform, you see that can also be tweaked to take in more features specific to the needs of that particular one. So we have the current is just one example. There's no other examples. Made EMR solutions. So I think that's the most recent analogy that comes to mind.
Dr. Dewa, I will take you straight to stakeholder engagement because I know you play around that aspect a bit. From your perspective, how might partnership between government agency, healthcare providers, pharmaceutical companies, NGOs foster a tangible improvement in healthcare quality across Nigeria?
Thank you for that question. And the example about Curacao is very interesting. That when Curacao really started into the market, they were trying to rebuild HIS solutions, and then they gradually started engaging with Redcare mostly.
Yeah.
And Redcare helped them to pull providers together. And through that all fora, that multiple different providers, EMCAN, they even brought the insurers, they brought a lot of people to the table for Curacao. We were able to see Curacao get from, we just wanted to do EMR, to really understanding what the problem really is with this group of stakeholders and their engagement, right? So they saw that point of friction because there was an HMO, right, who had their goals set as, we want to reduce the friction between us and the hospitals. If the hospitals adopt technology, it will make it easier for us to track what they are doing and also for us to easily reimburse and all that stuff. For the hospitals as well, let's bring them to the table, let's find out. So such engagements, that's like, I was using the Curacao example to show how such engagement changed the trajectory of a business to now, building something that's even more impactful for the entire ecosystem. They're so important. And because of them being important, we need to now start looking at how do we do that beyond just the private sector to involve the government, for example. And you would see examples like Emergency Response Africa has been able to partner with states to really now take over the emergency response or build a platform for them to manage it. We're seeing other sorts of engagements now where, say, if we go back to COVID, where there was actually that opportunity, and they really pulled in startups and pulled in private sector, pulled a lot of people. So if we are to move forward as healthcare providers in Nigeria, where the system is fragmented, stakeholder engagement has to be one of the key things that we need to build into the culture as well as the DNA of how we run healthcare. And it really just helps us to unearth the problems, and then unearth them in the way where the people who can solve the problem really have access to the people who are facing the problems. And most of the results that come from it actually come out very, very good. So I'm 100% for it. How we can do it better is where I think we need to improve. Most of what we've done so far is a lot of talk shows, a lot of conferences, and all of that stuff. We need to be more technical working group style, especially when it's government type stuff. So the government say, okay, create a group, get like committee staff, get almost all the top people who know about this subject area and bring them in. Then bring the people who are actually the ones facing the problem so that they can all dialogue and do it that innovation style, design thinking, and get things done. So I feel that's the only addition to how we're doing things. We need to just improve it. But it's impactful and it's very useful.
Okay, let's go straight to data. Yes, because Nigeria is, well, we're trying to get better, but then there's still a data problem. So data-driven decision making is pivotal in healthcare advancement. How can partnership between healthcare institutions and data analytic firms, employ smarter decisions and ultimately make patients' care better in Nigeria?
Okay, so I think for that, it is best to start from the ground up. And what I mean by that is the fact that, so data as we know it right now, does a lot of things. And it also means different things. For a primary healthcare facility, data might just be the average number of drugs that can be found at a dispensary at each given point in time, each given point in time at different times of the day. And for a larger organization, perhaps tertiary hospital, data might mean the revenue per specialty, the average consultation per specialty, the average revenue per birthday, a lot of things, right? So fundamentally, it is important to even understand what data is needed from each particular establishment. And that's one. The second part is also ensuring that the human resource capacity available in these hospitals or these organizations are data receptive. So, it's like you're trying to introduce a solution, and the persons to whom you're introducing those solutions do not even know how to go about adopting them or even implementing them. So you're going to have a gap, a significant gap, which will even slow down the timeline of delivery or implementation or whatever it is you want to do. So first things first, using data to solve healthcare related problems requires ensuring that the healthcare stakeholders themselves, not just the doctors, now even the front desk executives, not just the medical records themselves, even the nurses, even the marketing unit, every single person understand what data is needed to get them from point A to point B. So data is an umbrella term, but then there are nuances that have to be considered for you to ask, okay, this is the kind of data I need, because for all you know, you can be farming the relevant data. And the data that you think is entirely irrelevant, will be more beneficial for another. So understanding what kind of data is needed is fundamental. Also ensuring that the persons in charge of various decision-making processes at the hospitals now know how to use data, know how to interpret data is very key. Because then it becomes very easy for data analytics firms, as we call them, to swing in to say, okay, how do we help you? Because if I, as a data analytics firm, should approach an organization, I have to make sure that the solutions I'm trying to provide to that organization are bespoke. They are fit to the needs of that specific organization. And then, how will the organizations themselves even know the kind of data problems they have when they don't even understand the language of data at all? So the fundamental is extremely important. When we have addressed all of that, then we can go into the different magic. Of course, we know the benefits and the significant impact that data allows us to do. Data allows us to do the kind of drugs to get for a hospital, for instance, the kind of equipment we even purchase, the days when you're going to have some consultations or some surgeries. It informs virtually every decision-making process in any organization, not just healthcare. But it's really important for the stakeholders themselves to understand what data entails, right? And why this is important is, or where this comes to play, is ensuring also that, of course, maybe data analytics firms can start by maybe organizing workshops around data analysis as we know it, the fundamentals of data analysis, what data is there, because the learnings from such sessions will then allow some kind of intuitive thinking on the part of the healthcare stakeholders to say, okay, based on what has been discussed at this workshop, maybe these are the kind of things we need to start looking out for, right? And then after understanding these things, it becomes easy for data analytics providers to build solutions that are premised on the problems that have been identified by the healthcare stakeholders. So again, it's procedural. And it's not just throw your hook and line in the water and expect to know what kind of fish. It's important for you to know the kind of fish you will have in that water, whether they will serve the purpose of it, like looking to just put your fish in the aquarium, or whether you want to eat it, or whatever it is. So it's really important to understand the various ingredients before we then say collaboration is needed. What collaboration is needed, for instance? So understanding the realities of your target stakeholder group, that's healthcare stakeholder group, would really help. And that can never be achieved until stakeholders themselves understand the fundamentals of this data mining or data interpretation or data analysis process. So that's the method I think would work in the Nigerian context, because it's really important for us to understand that
difference.
Angola may not necessarily work in Rwanda, even though the problems are the same. The different factors superimposing on those problems might be uniquely different. The problems might be identical, but what is fueling them might be uniquely different. So it will be counterintuitive to try to apply the concept in A to B. Exactly. Yeah. So understanding the rudiments, like I said, is fundamental before you then go towards building solutions for the actual stakeholders themselves.
Building on what Adesegun has mentioned, we need technology to get this data right. So I want to ask about how Nigerians, especially in the healthcare sector, have been able to adapt to technology. We have a lot of digital healthcare technology, apps, software, and all of that. But what has been the adaptability with patients, with doctors, getting this data from the patients and then seeing that they know how to use the technology, what data they need, and all of that, and even the healthcare providers themselves interpreting, just the syncing of this technology. How has it been?
I would say, honestly, I have very diverse perspectives to this around the fact that, for one, where I am now, from day one, it's been tech. Fully integrated, fully digital. We don't have any paper-based anything, right? And we even have all the way to the mobile app for patients. So patients can do a lot of things on their mobile app. They can book teleconsultations, they can book appointments, they can send messages, make payments, do a lot of things. And that uptake is good. It shows that when it's available, people will use it, especially when it's helping them and solving some inconveniences for them. Because obviously, you come in, instead of waiting for your test results, you can view it on the app. So you go home, right? And you can book a video call to discuss the results. So it saves people time. Now, we step out of this our own context and see what's it like generally in the market, right? And you now see different levels of integration, of where some people have fully deployed technology, some people are halfway, they're still using paper for some things, but maybe they're using one localized software in accounting, then another software for nursing processes, and there are different things that are happening in the market. And then you still now go to, say, the public hospitals or the primary healthcare centers where it's paper.
Yes.
And you go to some centers, they've deployed EMR, like Lagos Island Maternity, very wonderful hospital, functioning well, and all of that. So I feel the level of immersion always comes, because like Lagos Island Maternity, they are currently on their mobile app as well, like this. When they launched the mobile app, the people who use Lagos Island Maternity are people who would go to any other general hospital. So they will still buy into all of that. Right now, they've bought into the fact that their cards are different. It's not that somebody is writing paper somewhere. There might be some registration here and there, but everything is digitized. So I feel that the reception has been great, especially for the fact that most places have even adapted their systems to be more user friendly. FMC Ebute Metta was one of the first places that did that. They noticed that the elderly nurses were feeling left out, and the issue was mouse. They didn't understand how to use the mouse, so they changed everything to touchscreen. Right? So those types of adaptations, they will just rapidly improve the uptake, and everybody is starting to. Then gradually, those elderly people will leave the system because it's too stressful for them in the first place. And you have younger people who you can roll back to mouse for if the touchscreen continuity becomes or sustainability becomes an issue. I feel also that where we are, patients themselves are starting to ask for a lot of these things. Yeah. Because we're getting a generally more digitally native population, and those are the people who are actually the key contact people that we have to interact with as healthcare providers. So even if their elderly parents can't do stuff, they would. And you will see people are using Climate app to do code for their estate, and generally it's not just in healthcare. That movement is in banking, it's in estate management, it's happening across. People are using WhatsApp. So even most of the solutions now, we've built a WhatsApp bot to respond to things quickly. All those things are just getting into the social roles that we already have, and that's the best position for technology to meet people, right? Because technology and the way people behave, they don't necessarily align. Technology always seeks to change the behavior, right? So over time, it just has to mix. Because we have technology, because everybody is Snapchatting, everybody is doing this, it's now such a cool thing for you to have a Snapchat doctor who Snapchats his whole surgeries. And you get, so it's all that type of stuff, and we are getting there as Nigeria is concerned. The last part is, when we think technology, most times we're just thinking about the electronics, but it's also the most recent SPECT-CT or this new MRI that will help you to do this, and 5G being able to help us, start thinking about, do we get a Da Vinci robot into Nigeria to do some, robotic surgeries and all of that. So there's also the back end and the advancements, even down to the implants that are coming now. So there's a lot of things that are improving, and the adoption is showing also in the outcomes that patients are getting, not just the patient experience related technologies.
Okay, that's good. And last question for you, Adesegun. Let's talk about human resource. Yes, so the human resource factor is very critical for healthcare excellence, right? Now, how might collaborations between education institutions, professional association, healthcare provider booster the training and growth of healthcare professionals across Nigeria?
Well, like I said earlier, it's always a relief when the government is mentioned on some of these things. Again, not to absorb them of responsibility, but to understand that there are lots of fish to fry.
Yes.
And they can only start one after the other. Fine, there might be some they will to do simultaneously, but healthcare is not something you want to rush.
Yes.
Either you're facing it or you're not facing it. So in the case of the stakeholders you mentioned, the educational institutions, the private sector, and all of that, I think fundamentally we should even start from the regulatory process. So right now, there are very few
private hospitals in the country that have been licensed or accredited to run internship or housemanship programs, whatever their profession is. And when you look at that, it pales in comparison to what obtains in the Western
states, countries,
developed countries. And for the private organizations or for the private hospitals, it's mostly not a function of whether they are ready. Many of them have demonstrated readiness, but perhaps for fear of the tedious regulatory process, right? You see that maybe for some reason or another they back out. I mean, from direct experience, looking at our organization and what we did, we saw that the various regulatory bodies were very friendly. They were very receptive. So that's the MDCN, the Nursing Council, the Radiographers Council. They were extremely friendly and cooperative. And in fact, that gathering allowed us to debunk the myth that these things are very good. Like they now are at the forefront of wanting a lot of private organizations, but they move around. And the question they ask is, if you have all of this, why not begin to take people in? And people work. And this is not to say it's a walk in the park, because they also have to ensure that the qualitative metrics are upheld. It's not enough for you to have infrastructure. There are critical parameters that you are deficient at. They will ensure that you tick those boxes before your home and dry. So I think definitely it would be nice for private organizations in particular now. So my emphasis is on private sector. It will be really encouraging for them to set out to do this, because there's a lot of talent out there. And what you would even see is some graduates, medical school graduates have to wait sometimes for a year doing next to nothing just to get a housemanship slot. And when you look at how much time has passed, you'll even see that there's some kind of erosion of knowledge that would have taken place. Because when you look at when they did their induction, and a lot of time has passed. And it's natural. Some of them even pick up other crafts. While waiting for housemanship. So it then dilutes the quality of trainees that you would get, because they're no longer coming fully fledged. They have interest elsewhere. So it's very delicate. So I think from the perspective of enjoining private organizations to put themselves out more and pitch for accreditation spots, I think that's one important thing. I think also with regards to educational institutions, I think, of course, we know that observerships and internships are now becoming a thing. Every now and then I get an email from one student or another, including foreign-based students in Lithuania, Ukraine, Germany, asking to see whether they can do their observerships at different organizations here in Nigeria. And you see, with more adoption from educational institutions, I mean, there are quite a number of private organizations, private schools, universities doing that right now, positioning their students at various centers of excellence, healthcare excellence, learn, practice, and all of that. I think if we can even have more adoption of such skills from public institutions, because public institutions is where you have
the bulk of the papers.
The bulk of the students, right? I know that they tend to be very procedural and sign this and that, but I mean, I know that the vice chancellors, a lot of vice chancellors right now are being very right up there. And a critical example is the vice chancellor of Black, Professor Mushala. She is seen everywhere. I mean, I saw her the other day. I saw a post where she was having some kind of dialogue with the School of Public Health, so Kansas Medical School. So initiatives like that are very, very important. That's exchange of knowledge, prepping your students for the world ahead. So not just for housemanship now, even letting them know that, look, before you even graduate, you can set a path for yourself. And I think these things are critical. The collaboration, but knowing there's whom to collaborate with, and also debunking some kind of preconceived notions you must have had in your head would also go a long way.
Okay, and the last part, which is the big
elephant in the room: funding. Funding, yes. Sustainable funding is the lifeblood of healthcare everywhere. Now, how can collaborations between financial institutions, healthcare providers cultivate innovative funding mechanism that ensures that healthcare service continues? It's a continuous process. It's not like we start projects now and we stop because there was lack of funding.
I think that's a massive question that everyone around the world is trying to answer. Especially right now where funding is really scarce. But I think that the sort of local way to look at it is what the financial institutions, from the banks, the regular banks, to the microfinance banks, to the fintechs, can do to transform the healthcare supply chain.
Okay.
Because what's happening at the hospital level, for example, is the result of all the interactions before the person is selling equipment to the person that brings the dance, the person that brings the implants, the customs component of it, the importation, the duties, tax. So there's still a lot to play around that with very innovative mechanisms.
Yeah.
As opposed to, coming to actually say, okay, we actually need to raise money, raise equity, raise all of that. There are opportunities there for the institutions, the financial institutions broadly, to figure out deals that would have a wider impact on the system, right? So if we're going to say the key, so they say, for example, so that one of the key guys, guys is consuming.
Okay.
And we're speaking to them about same discussion is how we increase the price of these things for the next 2 years. The only thing that's going to make anybody fix the price is if money is available. So you can use the money to do something else and make the upside that they're going to pay on that. Right? And the banks that make that money available, knowing fully well that fixing that they've done guarantees a certain amount of stability in the market, and it helps the people in the players in the ecosystem to stay stronger.
Okay.
And deliver more value. Right?
Okay.
That value going from point of creation to the consumer in itself drives sustainability. Because one of the things in sustainability that we often overlook is how do we actually really get the value that we are creating.
Okay.
If we are struggling with distribution, then obviously we have limited access to stay sustainable. So we need to look at all those things from those points of view and start to dig deeper beyond what we can do with hospitals, what we can do with healthcare.
Okay.
Those are, to me, the interfaces.
All right.
That's where people just come and interface. But the real work is 3 steps behind. Like the person who is somewhere gently figuring out how to get those implants and those consumables to Lagos, and there's still another person who's going to collect it to Lagos and figure out how to turn that into business. Figure out something for these people, make their life easier, make their work and everything. If we can make
everything seamless,
smoother,
less stressful,
access to cover. Because what typically happens here with suppliers is that suppliers are now tied into this 60-day or 90-day payment cycle.
Okay.
Right, where they've supplied, they sign contract. Because they sign contract, the person has signed the contract that your payment might take 90 days.
Yes.
You know, and you're at that point where we need to do another shipment. You get, so those are the loopholes where most of these things can happen. And for the hospital, it's like they are also giving those 90 days because HMO has given them 90 days. Everybody's
on a 90-day cycle. Okay, that's interesting to know. I've gotten the feedback on a topic that I can look forward to, addressing that issue you mentioned. And coming to what Adeshegun mentioned, in terms of training, I know that even the government now, they are very big on training, because I was speaking to the commissioner recently and he just kept mentioning about how they're, investing in training their own healthcare providers to, curb the Japa syndrome that we have currently in our country. So just a final word, what is your hope for healthcare in Nigeria in the coming years?
I think it's very hopeful. The scenario is already looking good. More big hospitals will come in. At least it's clear now that we can do larger size. It's the same problems that will affect all of us is still this workforce issue, right? What I'm saying with the workforce issue is that as we lose, we lose, and then in 5 years, 10 years, we gain some people. We're also seeing the people who are just shuffling in and out, so that's good. So there'll be a lot more of that, and I feel that we will start to see more super specialist skills.
Yes,
those super specialist skill sets, they're very expensive, and it's hard to actually sustain them here in Nigeria, especially when the demand is not high. So once we are able to figure out the demand side, which is aggregating money, increasing insurance coverage, which are things that I think will gradually, that insurance thing is starting to pay people. So they are looking for it now. Like state insurance coming in, deploying technology, distribution is getting out there. So I feel we would have better healthcare. We would have better healthcare. How far that better healthcare gets from, the upper class who easily have it now, or the middle class who try as much or struggle to have it all the way down, is what we need to focus on. And we need to generally improve our primary healthcare. That's the foundation of the component.
All right. Okay. In our last conversation, you mentioned about those super specialists. Okay. Yes, I'm sure you also mentioned them towards the future of healthcare. Is that still what your hopes and aspirations are?
Well, yeah. So absolutely, because right now, a lot of well-to-do customers are tilting more towards minimally invasive intervention.
Yes.
Which means they can be caught upon in a minor way, get their problems fixed, and they get discharged almost within the hour. That's what everybody's looking at right now. Of course, that expertise is expensive, just as the was I alluded to earlier. And quite frankly, I believe that for us to really get there, we know it's not going to be easy for anybody to pay out of pocket. Even once they still try as much as possible to secure themselves with whether advanced insurance, international coverage, and all of that.
Okay.
The role of insurance cannot be overstated because you see, with the way healthcare is going, it'll get to a point where even from the perspective of the family, a nuclear family, father, mother, and child, there's going to be a significant portion of their income dedicated to healthcare or preventive healthcare, such that they don't even need any kind of invasive surgery or whatever. We understand the role of maybe some kind of idiopathic conditions. Those are the ones that you can't even prevent. But for every other thing, we are going to see rather a lot more commitments from the individual units. So these are not governments now dedicating something to insurance or whatever. Individuals themselves saying, look, based on what I heard the other guy pay for the healthcare. I have to do this and that. And just as the Lord was saying, collaboration is also essential. But for me to know whether it is important to pay for health insurance, I have to have even heard from the various insurers themselves. I have to have heard the HMO, perhaps via an event or something, or via some kind of communications, marketing communications, publicity or whatever. Let me know that, look, this is where things are going right now. Just buy and keep. You can never go wrong. Because the benefit to be derived from buying and keeping is, significantly outweighs not even buying at all. So at the end of the day, health insurance is super huge. And I feel like we don't even have enough health insurance organizations in Nigeria right now. And even while some might argue that we do, there is still that gap in product market fit. We are developing some insurance products that do not necessarily meet the needs of some persons who have enough money to even pay. So insurance for sure is a bedrock. And lastly, the primary health
care centers.
Because I know that the private health sector alliance of Nigeria, they are doing something interesting.
Just adopt a health facility.
I think it's good. They're trying to position global standard facilities in each of the 740,000. It's good. And can only hope that there will be more commitment to causes like that, because primary health is where everything starts from.
Yes. Okay. And so that brings us to the end of this conversation. And for me, I hope and look forward to a more beautiful healthcare sector with quality healthcare delivery and collaboration. So thank you so much, Dr. Debo, for honoring this invitation, and also Mr. Damaze. It's been lovely having you again for this conversation. So till next time, cheers and be safe.